Coronavirus has hit all aspects of society, but gender divisions are beginning to show. Women make up 70% of health and social workers, putting them at greater risk. Other industries where women dominate have seen heavy job losses, but those in charge of policy responses are predominantly male.
When I think about what's going on with the COVID response here, I think about, the failure to remember the impact of lockdown on domestic violence victims, and the failure to, for example, be clear about whether domestic violence workers are included in the key workers who can send their kids to school. I think about the failure to account for who is going to be doing the unpaid care work when kids are sent home from school, and are those women going to be compensated for having to take time off work?
This is a crisis situation, and the fact that women have not been factored in is frankly criminal and really immoral, in my opinion, because this is the 21st century, not the 18th century. And to have to begin by arguing that women should be visible tells us a lot about, how far we still have to go.
In fact, a profusion of articles and news stories have recently informed us that when it comes to COVID-19, as with any health scare, natural disaster, armed conflict, or economic crisis, women are most affected.
Pretty much what you see in all disease outbreaks, that women are more exposed, they are more likely to catch whatever the disease is, and that is to do for gendered reasons. It's not a biological issue generally. It is because women are more likely to be the caregivers. They are the frontline healthcare workers. They are the ones working for poverty wages. And
this is exposing a major underlying problem, our failure to deal with an ongoing problem. And in this case, it's the fact that the economic system doesn't work for women. Women are more likely to be poor, they're more likely to be in insecure employment, they're more likely to have care responsibilities, they earn far less, they're far more likely to be poor in old age.
The paradox of the situation is that the very people that this government and that the economic system has created as disposables, the people who've been consigned onto that rubbish heap, are the very people now saving lives. Because if this has highlighted anything, it's highlighted our interdependency. Everybody has worth, and everybody's contribution keeps us all alive and secure, and living a life as human beings.
Generally, after a crisis, things can either take a big leap forward for women, or they can go backwards. Sometimes a return to business as usual is like a return to the way things were, because then people feel more comfortable and more happy. Sometimes people have a recognition that we can't have business as usual because that led us into this mess. And that's a realization we need, but it won't happen on its own. We need to make it happen. One of the things that this crisis has shown us is that we are all interdependent. We depend on each other, and therefore we need a society that recognizes human interdependence and has that at its heart.
I'm very, very certain that if we can put things into place in moments of crisis, we can try and make them exist after the crisis. We can change the narrative. We can change the way in which we work. And that is why how we react in terms of crisis and what we put into place is so vital, because we could try and defend it afterwards.